So I had a really good question or comment, and I wanted to respond. So the comment was to if I could explain a little bit how I think holistically, like what that actually means. So just off the top of my head, let's just pick something like something common like stomach ulcer. Okay, so let me just start with there's lots of causes. Okay, and thinking holistically about it, let's start with conventional medicine. So conventional medicine sees that there is a defect in the gastric lining of the stomach. Your stomach acid is intense. pH drops down to, I think it's high ones. It's usually high ones to two to three. So if the stomach lining should have a nice coat of mucus over those cells in order to protect those cells from the stomach acid. And the purpose of the stomach is to not only hold that food that you just digested, but to let that stomach acid start to break everything down. Also to kill different bacteria that have traveled down your esophagus, down the food tube, or were in the food. So in conventional medicine, when I first started, H. pylori, I think, was just being discovered. So what was used would be a lot of antacids in order to bring the stomach pH down so that you didn't feel those symptoms. Once H. pylori was discovered, most everyone gets tested now for H. pylori. If you have that, then you take a cocktail of antibiotics and then you retest, and ideally the H. pylori is gone and now your stomach can heal and you're all good. But we have a lot of people who have to take different types of antacids, and most of them tend to be H2 or histamine blockers of various names from various drug companies. So that's going to be your mainstay even to this day. Now the thing is these antacids, they are not meant to be taken long term. They have their own side effects and consequences if they are taken long term, but they're just prescribed and people are just given refills upon refills. So people are taking these for years. So I had, when I first started practicing Chinese medicine, this was after medical school, after Western medical school, I had this patient. This was when I was in San Francisco, and he had been taking, I don't remember if it was Prilosec or Zantac. Anyway, he'd been taking this for months and months and months. It might have even been over a year, and he was still having issues. So back then I was making my own formulas. I would have these different herbal tinctures. I'd put them together. I would start with like a classical Chinese formula and I would modify it to customize it for the patient. So I gave him a formula. I did acupuncture, made a prescription for acupuncture. And I think I told him to come back in like 2 weeks. Comes back in 2 weeks. He's like, what did you do? All of a sudden, I'm not having any of this pain. I feel so much better. Then he started telling me more. He's like, I'm not bloated. He didn't tell me about his, I think I had even asked, but I think he had some constipation as well. But these other things had cleared up, and I take a pretty good history, but he hadn't told me some of these things. And so these other things had cleared up. So my approach with the holistic or the Chinese medicine was Chinese medicine. Let's say you come in with a symptom that conventional medicine says symptom pill, or symptom medication, right answer, one right answer. In Chinese medicine, there could be 3, 4, 5, 6 different causes for the same Western diagnosis of having peptic ulcer disease or gastritis or GERD, gastroesophageal reflux disease. Okay, so these are all kind of the same thing. So for him, and I don't remember looking back, but a common pattern for Chinese medicine is liver invading spleen. Now, unfortunately, the terms in Chinese medicine has overlap with the terms in conventional medicine, so it can get kind of confusing. But you have this liver energy that can invade the digestive energy. That can cause a whole host of issues. You can get belching, reflux, you can get headaches, you can get indigestion, you can get bloating. Another pattern is someone having something called spleen qi deficiency, where the digestive energy has been weakened. They're having a hard time digesting their food. Oftentimes there'll be bloating with, there's different causes, overworking, overstudying, having energetically cold foods and drinks over a long period of time can damage the digestive energy, the spleen energy. Sometimes people can actually become susceptible to colds and flus, or they get sick very easily because their immune system drops. The digestive energy, the spleen energy, is related to this armor that's just underneath our skin in Chinese medicine that protects us from pathogens. Another pattern could be that the kidney energy, which is almost like a pilot light, like it warms the body, the kidney energy could not be supporting the spleen energy. So you could have a kidney deficiency and a spleen qi deficiency. So these terms, they sound odd and kind of woo-woo or a little wacky to conventional medicine, but it's describing patterns. And the best doctors, particularly the diagnosticians, they recognize patterns. So that's just one aspect. Now let's go a little bit further. There is we all have biological programs. We are all mammals. We share certain things with mammals. And whether we like it or not, we have these programs that kick in order to help us survive. So an emotional, a psycho-emotional program could be a territorial conflict. What does that mean? You're at work and someone is trying to take your job. You're in a relationship. Someone's trying to take that person. There's something that is you cannot digest. And the biological program is to create more stomach acid in order to digest this indigestible morsel that you just can't stomach, right? We even have some terms for it. So you can't stomach this. This is just, it's eating at you. It is pissing you off. Something that you think about before you go to bed. It might be waking you up. You could be dreaming about it. When you wake up in the morning, it is the first thing that comes to mind. And your body is responding. It is running the program in order to help you survive. Now, the thing is because we are such mental beings, this is the power of the mind. Your body doesn't necessarily know if this is something that is real in existence or if it's in your mind. Because you're thinking about it, it doesn't make a difference to the body. You're sending out all of the signals. You're sending out all of the communication that is the same as if it's happening in real life. It doesn't matter if you are experiencing it in real life or if you are imagining it. The mind is extremely powerful. Okay, so that's another layer or another way of looking at that issue. Let's go a little bit further. It could simply be your nutrition. Are you someone who is so busy that you're ordering fast food? You get the fast food in your car, you're driving, you're eating. So you've got this salt, fat, sugar bomb, sucking it down with an energy drink or a big gulp, right? You've been doing this since you've been so busy. You've been doing this for weeks. The weeks turn into months. Maybe the months turn into years. And eventually you get to a place where your body's like, I can't compensate anymore. Just can't deal with it. What do you think happens when you clean up your diet? What do you think happens when you're not having to drive and eat? You can actually sit down. Imagine some candlelight, soft music. You've got all the time in the world. You're chewing your food 32 times every single bite. Nice digestion. That's going to change how that stomach ulcer reacts. Let's do one more. So I think the book title was The Body Keeps the Score. I think that is the title. So when we have emotional traumas, when we have things that have happened to us, our body remembers. So it could very well be that you had an experience, you may have forgotten it, but you have an experience that your body continues to remember and express itself. And it could very well be that it's in the form of your stomach, and your stomach is all in knots, and you feel that tightening. You have this feeling of almost like a hollowness, or sometimes it's sharp or like a pick, and that's your emotions talking through your body. And imagine what happens when you get in touch with that emotion and allow that emotion to express itself, to bring it back up to the surface, and then address it, deal with it. More than likely, you're going to resolve what's happening with the stomach ulcer. Ooh, let's do one more. So, hydration, water. We are more than 70% water, okay? Americans are also, on a whole, chronically dehydrated. So people experience dehydration differently. Some people, when they get dehydrated, the first sign is a headache. Some people, the first sign is muscle cramping or tightness. Other people, it could be that they get a very dry, scratchy throat. Some people, their kidneys hurt. For some people, though, it's their stomach that starts to bother them. That's the first sign that they have of dehydration. And by rehydrating, all of a sudden the symptoms start going away. But imagine someone doesn't know that. Imagine someone has a lifestyle where they just keep going and going, and they're chronically dehydrated. They're given medications, or they're taking something that's symptomatic, trying to blunt or get rid of the symptoms, but they still remain dehydrated for years and years. So what I've laid out to you is just, we didn't go into too much detail, but I just laid out to you how my brain works, how my thought process works, because there are different theories of medicine. And what I think is important is you at least are thinking of all of these, that you have different tools in your toolbox to be able to address clinical issues, to address people for where they're at, and the most elegant and simple way of dealing with a particular issue. I want to do it the quickest way, the cheapest way, with the least amount of side effects. I want to be the most efficient and the most effective. So that's what I think is important for being a holistic medicine doctor. All right, thanks.